Warm greetings from the High 10. It is Everyday Shenanigans on this Wednesday, April 1st, 2020. Yes, I know I said I was logging off for the evening, but more crazy news has come across my information desk that I thought I'd best get out. Uh, I'm going to need a break from this because now I think I am on video 8 today. So Queen is on a roll. I decided to do this because I know a lot of you are pet owners, a lot of you have children, and a lot of you have babies in your house. So what I'm about to tell you is not good news pertaining to COVID-19, the coronavirus. I just got information about a newborn baby that died late last week. And the information has come to light from a post from the governor of Connecticut, Ned Lamont, as of 3:15 today, p.m., April 1st, that child, a 6-week-old baby, has been linked to the COVID-19 virus and is deceased. So this is the first baby on record to be linked to having come in contact exposed to COVID-19, and this is from the governor of Connecticut, Ned Lamont. He posted to social media at 3:15 p.m. April 1st, 2020. I also read in a Newsbreak app, 3 staff members at a hospital in Hawkins County, Tennessee, have tested positive for COVID-19, and the audacity of the official to say that anyone who has come into contact with these said people at this hospital need not get tested unless they have symptoms. What the hell are you talking about? Why not beat Corona head on? Because you see, we do not know the timeline of the incubation period. We do not know if people are walking around with the said virus and are feeling fine, because at this point right now, we have no idea what this virus is capable of. And now that I've brought you information about a 6-week-old child in the state of Connecticut dying and has been linked to COVID-19, why in the world should you tell people not to get tested that have come in contact with 3 people from a hospital in Tennessee, East Tennessee, Hawkins County? Anybody who works at that hospital should get tested. Anybody who worked directly close with those said workers, staff members, should get tested. You forgot, dodo birds, they have a life. They have friends, they have family, they have children. They go outside the front door. They go to the grocery store, they go places. So why should they not get tested? Those who work alongside them, their friends, their family members. This is why the virus is getting rampant. This is why the virus is out of control in New York. Although this region is not as populated as New York City, outside New York City, big cities, its principle. This is how things get out of control. Things get rampant because people are still going outside. People are still gathering with people. And that's all it takes. 3 people in a hospital in a small rural town area. You forget they also have a life, and they shop and they go places. And you have to count everybody who works in the hospital, staff, visitors, all those people who have come in contact with them at the hospital, all the people that they were around outside of the hospital. I mean, why should I even have to repeat this? This is stupid. This is what happened with a case outside of Illinois. A babysitter babysat for a family, allegedly, and then she notified them that someone she knew that knew somebody who worked at the hospital had the virus. So then the husband, wife, and kids got checked out, and my understanding they had it. So why would you not want to get checked out? What fool would tell their staff members, so long as you feeling fine, you come on into work now. You come on into work, you feeling good, you all right. But now if you start feeling sick, Start getting the cough. Now you come on to the hospital and get yourself checked out. That is retarded. If you don't have adequate medical testing for COVID-19 at your hospital, then just say that and say that to your staff members. But don't tell nobody they don't need to get checked out because they're feeling all right, because we don't know the incubation period of this virus. And that is a low blow and it's ignorant. And I'm going to go on and say it because I didn't want to say it in ink on my channel, but I'm going to say it out my own mouth. That is redneck, ghetto, ignorant, ratchet behavior. And it's insensitive and it is ghetto ratchet. It is heinous and irresponsible considering what is going on with this virus in this country and abroad. Everybody needs to get tested, affiliated with that hospital, because you all seem to forget, you stupid dodo birds, those people leave that job and they go out here to the general public and they're still driving their cars. They're still going in stores shopping. And then they go up the highway to visit Susie, Pookie, whoever, and pass the virus along. And before you know it, all of East Tennessee will have the virus. And it will seep over into Virginia, because Virginia borders East Tennessee. Hello, wake up. On to my story, part 2. I guess you said, Lord Jesus, there's more. Always, honey, always more pertaining to this demon-fied corona. Now, as I stated to you guys, a child has died late last week in the state of Connecticut. The governor just gave information today via social media that the child has been linked to COVID-19, a 6-week-old baby. Did not verify if it was a boy or a girl. But when I get the said information, I will bring you an update pertaining to that information. And also, 3 staff members have tested positive in a Hawkins County hospital, and their stupid superiors have decided to tell anybody else affiliated with them, don't get tested. If you don't have symptoms, don't worry about it. Now oh my God, I can scream. Ooh, God, just give me strength, because I'm about to really just go really ham right now. Second part of the story is pertaining to pets. For all of you who are pet owners, please take heed to the information I'm about to bring to you. This is by 2Fab. Second cat tests positive for COVID-19 after being infected by owner. This was updated today, April 1st, 2020 at 9:05 a.m. If you are sick with COVID-19, either suspected or confirmed, you should restrict contact with pets and other animals just like you would around other people. This is in quotes, says the CDC. The coronavirus pandemic has proven no one is safe, and now it looks like our pets could be in danger too. According to the South China Morning Post, a pet cat has tested positive for COVID-19 in Hong Kong after being infected by its owner. The cat is the second domestic cat to be diagnosed with the virus. Please take heed to what I'm saying, everybody. The city's Agriculture, Fisheries, and Conservation Department, AFCD, tested the animal via oral cavity, nasal, and rectal samples after the owner, a 25-year-old woman, contracted the virus. While the cat hasn't shown any symptoms, the woman is reportedly in serious condition. The cat in Hong Kong is the second feline to have tested positive for COVID-19. The first human-to-animal transmission was a cat in Belgium who was infected from their owner. Never heard that, you guys. A little over a week after they had returned from northern Italy, one of the global hotspots of the pandemic. Unlike the short-haired pet in Hong Kong, the feline in Belgium had developed symptoms including diarrhea, vomiting, and respiratory issues. According to Stephen Van Goot, virologist and federal spokesperson for the coronavirus epidemic in Belgium, the cat recovered after 9 days. The news of the cats being infected with the virus came after it was reported 2 dogs in Hong Kong, a German Shepherd and a Pomeranian, had tested positive. That is now 2 dogs, plus 2 cats. Mercy. While both dogs reportedly had low levels of COVID-19 and were both asymptomatic, the Pomeranian, who was 17 years old, died after being released from quarantine. The German Shepherd has repeatedly tested positive but has remained in quarantine. According to health experts, there have been no record cases of humans contracting the virus from their pets. We do not have evidence that companion animals, including pets, can spread COVID-19, writes the Center for Disease Prevention, CDC. However, the CDC advises that if you even think you have the coronavirus, you should restrict contact with pets and other animals, just like you would around other people. To read more of our coverage on the coronavirus, click here, and there is a link of where you can click to FAB. is the source for this story. So now they have told you about two animals, two dogs in Hong Kong. A German Shepherd and a Pomeranian have tested positive. The Pomeranian passed away. And then there's the issue of the first cat being infected with COVID-19 in Belgium. I had heard nothing of that. And now there is a cat was infected by his owner, a woman, 25 years of age, who is in serious condition. And that is the said information. I want to make sure I get all that correct. Okay. And the situation with the dogs, or with the cats in Belgium, they believe they got that from northern Italy when they, I guess, took a trip there. And then this other cat in Hong Kong. The cat recovered, the one in Belgium, after 9 days. Okay. Yes. Making sure I get that correct. The cat in Belgium recovered after 9 days. So there are a few pets as we speak. One has died and others have survived, but that's too much for me. Cats, now a 6-week-old baby in the state of Connecticut. And now they want to say in this article as well, we don't know that the pet can pass it to the owner, but now they're showing that an owner, human, can pass it to the pet. I don't know why they didn't think a human couldn't pass it to a pet. If a human can pass it to a human, why couldn't they pass it to a pet? A pet is a living being. It's an animal. This business allegedly started from an animal to a human, or animal to human. So why in the world did you all think a human couldn't pass it back to an animal? Man, come on with all this. Everybody, listen to me good. Because I'm going to get off of here. Because I'm just so aggravated right now. We can't believe half the stuff as far as who transmitted what to whom, how long it stays in your body, how long you're going to show symptoms, how long it actually stays on the surface. First, it's supposed to be 3 hours in the eye, 3 days on the surface. I don't know what to believe. But it looks like you are damned if you do, you're damned if you don't. You go buy something from the store, you now got to wipe everything down that comes in your Kroger bag, your Walmart bag. You have to wipe down everything. I don't care what it is. And if it's able to be took out of the packaging, take it out. Throw that in the way with your gloves on. Wipe everything down off your countertop that you sat in. You know what I'm saying? You sat everything on the countertops, your table, whatever. This is so daunting. God forbid you wipe your eye. Something falls in your eye. You rub your ear's itching, your mouth's itching. You got a runny nose. You are in bad shape fooling with this virus. And it's also stating, don't wear gloves. Just read that. Don't wear gloves because you're transmitting it from place to place. Your car, the store, over here, over here, over here, by not taking the gloves off. So don't wear gloves. Any type of gloves, domestic type gloves, regular type clothing gloves, no. Plastic gloves, no. They said it's safer to just touch something, then go wash your hands, spray your hands off with disinfectant, and then go back and do something else. But don't put the gloves on, leave the house, get in your car, go shopping at Walmart, go shop over here, pump gas, woo woo, with the same gloves on because you're transmitting whatever over here at Walmart over to the gas station, over to the next place. So you are passing the germs if there happens to be infection at the said location where you were. And I know you're all thinking, good Lord, have mercy. Yes. And if you decide to purchase those masks, make sure you are wearing them properly because there is a proper way to wear them. Just letting you know that as well. But I just read an article about the gloves that it is better to just come in from your errand running, wash your hands thoroughly, dry your hands. Don't wear the gloves from place to place. So that is the said information for this video today by Too Fab pertaining to the feline cats that have been infected with the virus in Hong Kong, Belgium. It has been relayed that a young lady is sick and passed it to her cat. First case noted of a cat in Belgium, but that cat has survived the COVID-19 virus. And something else I was wondering is, what are the odds of you getting COVID? Getting infected again? Just curious, because I haven't heard that yet. Because this is an early disease that's been out a couple months that we know of, but they're documenting also, as I stated to you, that there are cases of it that went back to November and they were not related to the wet market over there in China, at the said market where they believe the virus originated. So you see a lot of conflicting information, and you really can't get mad only because you really don't know who's to say how something came to fruition and how it came to be. That's just life. And that's the sad part of the situation. It's the not knowing. And now we're getting so many conflicting stories of this and that. We done went from a certain age group to now anybody can get it. And now you got to have an underlying condition to get it, to be at risk. Now it's being reported that animals have the virus, and the owners who have been inflicted with this, what is the word? Contract COVID-19 now can pass it to said animals. So now those of you who have pets, you need to be leery of your pets because, as I state, you don't know if you got it or not, and you're walking around kissing and hugging on your dog and your cats. And you know how some of you owners like to kiss your pets in the mouth. But you know you shouldn't be doing that anyway. I'm just saying. Be very leery. And also be leery of your children. Because now a 6-week-old has passed away in the state of Connecticut and linked to COVID-19. So now you mommies and daddies need to be leery of your children. And now you see why you don't need to be hanging around other people with birthday parties of 2, 3, 4, 5, because it's okay. I know them. It's my auntie's child, and don't nobody care about none of that. And let me tell you, if you get sick with your baby gets deathly ill, you are going to beat yourself up knowing you could not resist taking your child around other people, vice versa. Stop being stupid. This is serious. Because I got better things to do than talk about COVID-19, deceased children, all that. I'm bringing you said information so you can live, so you can stay in the know. And you all don't realize that these scientists, medical officials, and people, they really don't know much about this virus. And I'm not saying all of them aren't qualified, but what I'm saying is it's new, so they have to learn. And usually it takes fatalities to learn about any type of disease or virus. That's just common sense. So you all need to take heed And know that now there is no gathering with your friends and family. There is no sitting around people. There is no church. There is no nothing. People are dying. Now a baby has died. A newborn has died. And now pets have COVID-19. Stop being selfish and acting like you're missing something out there. Because Corona don't really care about you. Ain't you done figured that out? She don't care. She don't care about your baby. She don't care nothing about your pets. She don't care about you. So act like you're grown and act like you care something about yourself and your friends and your family and the community. Like, share, subscribe. Thanks for joining me. Thanks for listening to me. I'm praying for your safety. God bless you. God bless all of you. And please take heed to the warnings that your city, towns, and state has given you and the national government. Listen to what they have to say so you can be around tomorrow. Thanks for listening. God bless all of you. And this is Everyday Shenanigans, and thanks for joining me. Good night.